Good afternoon, everyone, and a very warm welcome to this launch, Ash's launch of their new Smoke-Free NHS Network. I'm Stephen Eames. I'm the Chief Executive of Humber and North Yorkshire Health and Care Partnership, and I'm really delighted to be here and acting as your chair today. Just a bit of housekeeping. I just want to say a few opening words after that. Thank you. Yeah, so that's up on the screen now. So if you have any technical issues, then there's the email to contact. I hope everybody's comfortable with the fact that we're recording this event and we'll be circulating the video afterwards. Please, if you can, when people are presenting, keep your cameras and microphones off. This is an interactive event, as you'll find as we go through. So we'll be using Mentimeter to run polls and a skill swap exercise. So hopefully people are knowledgeable and comfortable with Mentimeter. And please use the chat throughout to connect with each other or connect with us. And that will be immensely helpful as the event progresses. So I'm really pleased actually to be chairing this event today. I think it's a really important event in the ongoing work that ASH and the NHS and lots of other partners are doing to tackle the challenge of smoking in our society. I mean, why is it important? I'm talking to an audience here that probably knows why this is so important, but I won't apologise for just stating why I think it's important. You know, it causes 16 types of cancers, heart disease, dementia, stroke, COPD, and certainly makes smokers more vulnerable to infectious diseases such as, you know, COVID, which is still very much with us, and flu. What's more, what we find in our population, I'm sure it's true nationwide, is there's a large proportion of smokers in those population most in need of our help and support. So if the collective mission, if you like, the North Star for integrated care systems in England is about shifting the dial on a healthy living and long-term living for all of our communities, then why else would we be focusing on none other than smoking and smoking-related diseases and all the various tobacco control activities that are going on? So that's why I think it's important. Just to put something behind that in terms of our own ICS, we do have some of the most deprived communities in England up here in Humber and North Yorkshire. And our North Star definitely is to improve the quality of life in these communities and level up where we can, as vigorously as we can, to the national average for life expectancy for men and women. Some parts of our patch, that's 15 years below the national average for men and for women. And that's why we're not sitting back here around this agenda, because smoking remains our number one killer, our number one area to improve our impact if we're going to meet those long-term aims that we've got. And we're putting £2 million over the next 18 months into this to strengthen our response and our public health team's efforts in driving down smoking levels. And we're delighted to be working with ASH and with other partners in looking to establish a new centre for tobacco control. And that will help us coordinate population level interventions, invest in programs of activity, such as the lung health check screening that we're rolling out right across our ICS at the moment. So I think every ICS should be doing this. It's everybody's business. And like I say, I'm delighted to chair this event today. And with that, I'm going to hand over to Olivia. Thank you, Olivia.
Thank you so much, Stephen, for your support and wonderful introduction to today. So I'm leading on this part of the work for ASH on the Smoke-Free NHS Network. So just wanted to introduce you a bit to the network. and start with thinking, what is a network and why it's important. So just to take it back to its basics, so networks facilitate connections and relationships between individuals, which is what we're hoping to do. But why do they matter? I mean, this is really about change, because change is a social process. So how does this all link up? So next slide, please. So if we think of change as a pie chart, 20% of that change effort is technical, essentially. So that might be your knowledge about prescribing NRT, or it might be your quality improvement skills. But 80% of change is to do with relationships and conversations, and that's why that's why networks are so important. Next slide, please. So by facilitating relationships, networks act as a catalyst and make change possible. So let's hear a bit more now about this network, the Smokefree NHS Network. Next slide, please. So who's it for? It's for all of you, obviously. So those of you working to implement, deliver, or improve tobacco dependency treatment services right across the system, whether you're working in the NHS, the local authority, in the community, or for a third sector organisation. And could you mute, please, whoever's speaking? Thank you. The purpose is to support members to initiate, establish, and embed really high quality, well-led tobacco dependency treatment services in secondary care. And that's our main thrust of the network's activity at the moment, although we will, as these services mature, be broadening out into broader sort of tobacco control measures. Now, how are we going to do this? Well, we asked you, we're going to use your feedback as a basis for forming this network. So next slide, please. We asked you, what do you hope to contribute or gain from joining the network when you registered for this event? And these are some of the things you said. So to start with, you said that you were looking forward to generating new ideas together and collaborate on solving thorny problems. Next slide, thank you. You were wanting to share your progress and experience, and some other people wanted to learn from listening to others, and we're going to do some of that today. You wanted to find out about available tools and resources, hear about new and emerging thinking, and learn about core topics in the field of tobacco control. So we took this feedback and we've drawn out a few themes. So some themes there, we're hearing about peer support, sharing and learning, collaborating, connecting with others, and really keeping up to date. That's how we've come to the how. So next slide, please. So we're going to be running more interactive events like this one, even more interactive, spreading good practice. So looking at some inspiring case studies, which one of which we've got today. And there'll be the opportunity to collaborate, sharing challenges and asking for help, whether that's in breakout rooms during events or whether it's engaging in games like the Skillshare that we've got for you a bit later. And all of that really is building opportunities for peer support. And in addition, there'll be our quarterly news and updates, which will come to you as well, similar to the updates that we have in our other networks. So next slide, please. So we're looking to grow this network. So do tell other people who you think will be interested and benefited from to come. We're delighted to have endorsement from clinical leaders. So we've got support from Helen Stokes-Lampart, chair of the Academy of Medical Royal Colleges, with this lovely, is really supportive quote: "The Smokefree NHS Network provides a much needed collaborative environment to facilitate our collective work." So, but we're looking also to grow our involvement from allied health professionals. I know we've got a lot of pharmacists here today, and managers, and having a diverse network, which will be well placed to make change. Next slide, please. So now's a bit of time for you to get involved. We'd love to find out a bit more about who's here today. So we're going to use this app called Mentimeter. So you can either, and we'll have some polls now, so you can either access it using the QR code or go to menti.com and enter this code. It will also appear in the chat and at the top of the slides. So if you don't have time to do it before we move off the instructions slide, then you can catch up. So I'll just give you a moment to grab your mobile phone or use your browser to go to menti.com, enter that code or use the QR code, and yeah, and then you should be able to join us. And we'll move to the first question now while everyone's going there. So you might need to yeah. Oh, we've always seen people seem to be already answering. Fantastic. So we're finding out where people work. And it's great to have such a mix across England. Some people working nationally and just a few working internationally. And it looks like we've got a fairly even spread across the regions, which is really nice. So that's what we're hoping for. That's great. A really nice spread so we can all get involved. So next slide, please. The next question is, you sounds like you're already answering some of these questions. So what is your job? So we're seeing the answers coming in here. Well, I'm delighted to we're seeing this as such a range of different roles. There's many people working in tobacco dependency, but we've got lots of people working in public health. We've got pharmacists there, people working in rehab. This is really what we wanted to see, such a real mix there. We've got a lot of information analysts as well, so we need that strong data element, which is so strong and so important in this area. Fantastic. Next slide, please. So yeah, and the other thing, we've already started getting some answers coming in here. Really wanted to hear about why ending the harms of tobacco matters to you, to get a sense of what's motivating each other of us. Why are we inspired to get involved in this work? So yeah, just to pick a few of these out. Health inequalities, that's a big one for me. That's why I came into this world. It saves lives, absolutely. It's not just people working in hospitals face to face with patients that saves lives. This definitely saves lives. It's important that's a holistic focus. It's important for the overall health of our patients. Great for the next generation. Do you want to scroll down, Jim, so we can see a few more of these answers about why it matters to people? So I'm sure that we'll find a lot in common in those answers. Great.
Doesn't let you scroll down, I'm afraid.
That's all right. No worries. That's brilliant. Okay, so I will hand back to Stephen now. Thank you very much. It's good to see such a mix of people there, and we're looking forward to all of you getting involved as we move forward with this event. Thank you.
Thanks, Olivia. That's a great start, and it was remiss of me not just to mention before I go on to Sanjay. Olivia has worked as a specialist. She's a clinician in palliative care medicine and has been working for the last 5 years in the charitable sector on implementing change in public health issues. This one obviously, but also in climate change and sustainable healthcare. And I think it's your leadership on change and influencing change, Olivia, that we really welcome in all of the work that's going on. So apologies I didn't do that at the appropriate moment. But if I could move on, Sanjay, welcome. Are we going to hear from Sanjay, who's Professor in Respiratory and Intensive Care Medicine at University Hospitals of Leicester, and the National Clinical Advisor for Tobacco Dependency to NHS England Improvement, and chairs the Royal College of Physicians Tobacco Advisory Group. He, with other partners, has developed the British Thoracic Society's National Tobacco Audit in Secondary Care, the BTS Tobacco Dependency Quality Improvement Tool, and delivered a Royal College of Physicians Breakthrough Collaborative focused on treating tobacco dependency. Sanjay also co-edited the RCEP report published in 2018, Hiding in Plain Sight, Treating Tobacco Dependency in the NHS. So that's a very distinguished contribution, Sanjay. I'm delighted to hand over to you. Thank you.
Thanks ever so much, and thanks everybody for joining today. It's really exciting to see where this network gets us. And I thought it'd be useful just to mention why I got interested in this area. So I run a lung cancer clinic, and one of my observations was that we were treating people for lung cancer and doing everything we could. Once people had symptoms, we did the diagnostic test, we started treatment, all absolutely, of course, right. But my regret was that nobody had addressed the smoking and the addiction to tobacco with all the healthcare interventions that these people had when they'd come to hospital previously. We know that there's over 1 million episodes where smokers are involved, where they come to the hospital each year, and you're 1/3 more likely to be somebody who smokes and be admitted to hospital. So there were plenty of opportunities to help people quit smoking before they ever got lung cancer. And you can substitute heart attacks, strokes, admissions for COPD, a variety of surgeries, in where I'm motivated by lung cancer. So there's lots and lots of opportunity for us. And so that's why this program of work is so important to me, that together we can all make a difference in this area. Can I have the next slide, please? So one of the other key drivers for me is health inequalities. We know that addiction, whether that's to tobacco, alcohol, gambling, are often concentrated in the most deprived and socioeconomically deprived groups in our society. And so by addressing tobacco addiction and breaking the cycle of tobacco addiction, we put money back into people's pockets. We reduce poverty, and we improve chances for employment and the whole levelling up agenda. And smoking is one of the modifiable risk factors that you'll have seen in the Core 20+5 graphic here. So whether it's mental health disorder, chronic respiratory disease, early cancer diagnosis, all of these things, if you address tobacco addiction, you're addressing the Core 20+5, you're addressing health inequalities. So smoking, not only breaking the addiction to tobacco, not only improves health, but it helps with levelling up. So for some of you who may not be that familiar with the long-term plan and the programme, I wanted to just be really clear. The aim of the programme is everybody that's admitted to a hospital, whether that's an acute hospital or a mental health hospital, or everybody who is pregnant, we ask the question, do you smoke? So we identify smokers, and if they smoke, we treat that tobacco addiction. So it's really straightforward. All hospital patients and all pregnant patients, we identifying smoking and we're treating it. Next slide, please. So what do I mean by treatment? So this is the pathway that we hope many of you will have already adopted or planning to adopt. So somebody's admitted to hospital or starting the maternity pathway. They're asked that question, do you smoke, don't you smoke? And if they do smoke, then NRT is prescribed, long and short acting NRT, to prevent temporary abstinence and to hopefully start them on a quit journey. The smoking status critically is recorded electronically, which generates an automated opt-out referral to tobacco dependency advisors, which are now embedded in every hospital pathway, in every maternity pathway. And this is a brand new part of our NHS workforce. It is just critical. That tobacco dependency advisor then sees the person who smokes and talks through all the options that can help them to quit smoking, including different pharmacotherapies and behavioural support. And when the person is discharged from the hospital, their treatment pathway continues in the community, and that smooth transfer of care into community services occurs in step 5, and that patient receives NRT on discharge so they don't relapse to smoking as soon as they get home. Step 6 is they're discharged home. In an acute hospital, that might be in 2 or 3 days. In a mental health trust, it might be 5 or 6 weeks after they were admitted. Step 7, the person receives ongoing pharmacotherapy and behavioural support from community stop smoking services, which may be local government stop smoking services or community pharmacy services, or some other hybrid model. And then step 8 is recording the outcomes of these interventions to make sure that we're delivering an effective service. And we also measure steps along the entire pathway to make sure that we understand that we're reaching the right population and our service is effective as possible. Next slide, please. So none of this can be done in isolation. And one of the things that Olivia said that struck a note with me is about relationships. And this pathway starts in NHS hospitals or in maternity services, but it continues into the community. And we know that this pathway cannot be delivered without the coordination, cooperation, and the working together of NHS and local government stop smoking services, and also in many instances community pharmacists. So I recognise on this call and in this network we hopefully have representatives from all of these partners, because it's only if we all work together and develop those local relationships will this pathway work. And I also recognise that the funding streams for the NHS programme and local government are different, and also the data and the outcomes that are measured need to be integrated across different partners, which can lead to logistical problems. And we're well aware of that, but many systems are now doing this quite effectively. Next slide, please. So where are we now? So this is a snapshot of where each of the 7 NHS regions are. In the green are those systems, those hospitals in those particular regions where the service is up and running. And in the yellow, it's where they're not yet started, but people are working hard toward getting it started. And if you look at the bar over on the right, of almost 200 different acute trusts across the country, half of them have actually started and at various levels of maturity, and the other half are yet to start but are making good progress towards starting. So for me, this is quite heartening. This has occurred in a 2-year period where we were recovering from COVID. Next slide, please. Now, in terms of funding, because nothing happens without money. For those of you who aren't maybe aware or part of the funding process, just to help people understand, the national team deliver funding to each ICS directly, and that funding started in 2021, and year 2 of the program's about to finish this week, in fact, and then year 3 of the program in terms of financial year starts next year. So we've had 2 years of funding already. The 3rd year of funding is about to be announced to each ICB, and the long-term funding of this program will go directly to ICSs. At the moment, it's labelled as tobacco funding, and so we know the amount and what it's used for. In the future, the exact model of how the money goes to ICSs may change. Each system decides how it spends the funding with respect to how many staff it needs, the banding of the staff, and the speed of service rollout. We know from conversations across the country that some services are within their funding envelope and have been able to carry over underspend from years 1 and 2, whilst others are struggling. We've also heard about local mitigations, such as scrutinising the staffing model and the banding and the rollout timeframe, and some places are also using money related to health inequalities. So I'm fully aware that some areas are struggling with the funding, and I'm sure that's something that we're going to be talking about at some point, and helping to people think that through, as well as looking at maybe those ICSs where they're managing within their funding envelope and asking the question, so what are they doing differently? Next slide, please. So in summary, it might feel very difficult for many of you who are just starting out or in the middle of it, but I think what I'm really pleased to hear about is there are also lots of areas across the country who are further along the track, who've actually seen their service delivered and running, and seeing thousands of patients now who smoke, who are coming through their doors. So I'm going to stop there and hand back over.
Thanks, Sanjay. And can I just thank you on behalf of everyone for your leadership and vision and commitment to this agenda. I'm going to move on now and introduce Andrew Stock and his team. And I think we're going to hear from some network members in the Northeast around relationships and networks and how they've been pivotal in making progress on implementing tobacco dependence treatment services in their respective areas. Andrew is the Smokefree Programme Manager in the North East London Integrated Care System, and I'll let Andrew introduce his team. Thanks. Over to you, Andrew.
Hi, thank you very much. So yeah, joining me today are Aidan Bone Avery from the Barts Health Trust, and he's the Health Improvement Coordinator. Then from the provider, so a stop smoking service provider in North East London is Shamsia Begum, and she's a service manager and she works for Queen Mary University London. And then from a local authority, we have Madalena Pop, who's a Public Health Commissioner from the London Borough of Newham.
Fantastic. Thank you, everyone. It's so good to have you all here to to share your perspectives. Do if you four unmute, and then we can all have a conversation. Yeah, so I'd love to kick this off just to say, firstly, it's really great to have an example from London. So we're wanting to draw, as we go through these events, we want to draw on each of the different regions for examples. And though smoking levels are lower in London and the southeast than perhaps in the north, there are areas of increased deprivation and very high smoking prevalence, of which Newham, where all of you come from, and that's the case in that area. So I think it's a really important example where you're from. So I wonder whether we could kick off with Shamsia, and whether you could just tell me a bit about your network and how they've grown from your perspective as a provider. It'd be great to hear from you. Thanks.
Thanks, Olivia. So my experience of networks, it started very small. I took over the Tower Hamlets service in 2017. And at that time, commissioners had put sort of various KPIs or targets for services to meet. And one of those included pregnant smokers and also people with underlying health and COPD. Yes. So when I did my first report, I was very shocked to see the very low number of referral to quit date set transfer from the National Referral System pathway. And that pathway is between our local hospital trust and our service. So in order to sort of look at this in detail, why were pregnant smokers referred to the service but not taking the service up, and also hospital patients being referred, and the numbers were very, very low. So I connected with the health improvement manager at the time, and we had very common interests and goals around smoking cessation, and we looked at why these figures were low. I consulted with my team. They were saying, well, the quality of the referrals aren't very good. People weren't interested in being referred. They were just referred without consent. So various issues arose. So I fed that back to the health improvement manager. And we then spoke about training clinicians around very brief advice and talking to them about the service that we offer. And also one of the things that our concern was the connection between the service and the hospital. So how do we connect? So one of the initial early things we did was, once a referral was received, we immediately sent out an automatic appointment to the service. And it was a drop-in, so people turned up. We didn't know who was coming. It was an open invitation. That kind of increased the uptake about 6%. And then, so training clinicians, having regular catch up with the health improvement manager, and talking about various ways that we can work. And then sort of alongside COVID, we saw a dip in our referrals, and then there was this wonderful thing that we developed, that we'd have an advisor from our service, so our pregnant stop smoking advisor in pregnancy, based at the hospital, to provide support in maternity to pregnant smokers, and then also linking our generic advisors with the general referrals that we got through secondary care. So then COVID struck, and then none of that sort of happened. And then we then got caught up in all the ICS planning. And fast forward to today, we have a very good partnership with Barts, our local trust, and I now manage Waltham Forest and Newham.
Yes.
And the relationship sort of developed further when we knew that Barts also covered Newham and Whipps Cross. And we were able to sort of transfer some of the knowledge and everything that we learned from Tower Hamlets into Newham. And why I mentioned Newham is it's one of our sort of kind of best practice services. It's where our networks and partnership work really well. We work with the ICS team, so the inpatient stop smoking advisors and the tobacco dependency midwife. We have an advisor from our service that links in with both of them. So all referrals are checked between each other. There's a sort of a clinical handover. So there's a very close link. And we were also sort of part of, helping to train the inpatient team. Sort of, we offered shadowing in the early days. We've got staff with, years of experience that were able to share that with the team. And so we see that in, fruition in Newham, where we do see a very nice increase in pregnancy uptake and also in just general uptake. So for me, it's pretty much about the relationship, and we took that further by making sure that we have a peer support team meeting every quarter with our colleagues at the trust, and look at the intricate sort of pathway and where we're sort of falling short and where we can improve. So this has been a great sort of thing for me and my teams, being part of a network, and that network becoming bigger in one of our local authorities. So it's a true example of how things work for us with regards to networks.
Yeah, I can see that you started small with that, initially reaching out to the Katie, I believe, the health improvement lead at the trust, and then growing it through a number of different methods, from training and mentoring and regular meetings, and making sort of formal partnerships with people. That's really inspiring. Thank you, Shamsi. And you've been able to achieve so much more because you've built those strong relationships and sort of a wide variety of organisations. Yeah, that's fantastic. Thank you so much. And Aidan, you're based in the trust in Barts itself. And I know that you've also been thinking quite broadly about who you connect with, and that's made a difference in your service. So it'd be great to hear a bit more about that. Thank you.
Yeah, absolutely. Just going off of what Shamsi has said there, the point on transfer of knowledge has been so incredible, and from the outset of our service starting, the actual professional development of our team, the local community stop smoking services had a really big impact through that training and that shadowing opportunity, because it's not just looking at how can you help someone quit smoking through NCSET, but going beyond that and seeing how it works in practice. So it's a really good point made there, and also exploring local trends. So in North East London, there's an increased kind of use of smokeless tobacco products. So having that local knowledge is really integral from the local stop smoking service as well.
Thanks.
Yeah, I would say as well that the kind of the close working relationship between our hospital advisors and the community services advisors as well. They work very closely. They kind of use shared databases to make sure that the patient journey is really seamless. And when we go to refer on post discharge after the patient started receiving support in the hospital, that they actually do receive support on the other end, and that we're giving that level of support that's consistent from day one. And that's really important when we're thinking about NRT as well, and nicotine replacement therapy, and the chance of relapse from your quit attempt between hospital stay and post discharge. That really close working there is so important. I think more broadly the network, so using Newham as an example of this, how the network supports our hospital teams to not only focus on the patient's tobacco dependence as an exclusive health requirement, but to use that time with the patient as an opportunity to scope the need on other determinants of health as well. Our close working with Newham Council, for example, and Maddie, who's on the call as well, has allowed us to kind of better link up and establish a smoother referral pathway onto other services. So looking at, does that patient need drug and alcohol support, weight management support, mental health, financial support? And that all comes together as part of a centralised directory of services that our tobacco dependency advisors can use and make referrals from now. So it's kind of looking at that patient more holistically and what their different health needs are, and that will also kind of feed into their tobacco dependence as well. And
yeah, that's wonderful. Just having the patient experience and their needs really at the heart of what you're doing. Yeah, that's really inspiring. Thank you so much. That's really good. Fantastic. And then Andrew, from the ICS level, you've got a bit of an overview, because I wondered if you could just say, yeah, a couple of words about that.
Yes, so in North East London, in the integrated care system, we're focused on collaborative working, so ensuring stakeholders working together to reduce health inequalities and also helping to achieve outcomes.
Yeah.
Previously, I worked in a tobacco dependence role within an NHS trust, and I wasn't part of a strong network. I personally wasn't part of a strong network, and it meant that some of the pathways weren't as robust. And when we were referring to community stop smoking services, such as the ones that Shams here manages, but not hers, a different one, the patients weren't always being supported appropriately. And because I had no relationship, and I had no with the service manager or with the public health commissioner, and I hadn't established any trust with them, so it did result in some delays and frustrations for the patients. It basically resulted in me having to compile patient case studies to prove that there was a problem. Now this problem went on for months. And it finally was, those case studies finally resulted in their getting the buy-in that was needed for the stakeholders to move forward and find a solution. But a lot of time was wasted. And using the Newham example that we're talking about, I'm confident that whereas it took me months in my overall, if that ever came up in Newham now with the network that's in place and the collaborative working that's in place, it would be resolved within hours or days, let alone months. So basically, when you have a strong network in place, you develop those relationships, you've built that trust, so you can work quickly together to improve pathways, and this ensures you remain focused on the outcomes. So in North East London, we've created informal networks where we link people and so people that can help each other to resolve issues, or if someone's in a similar role and they can share experiences. So we're basically looking to facilitate conversations and help people move forward. So we also keep in touch with what's going on throughout London and nationally through formal networks. And one example of this is the Tobacco Control Manager in the Office for Health Improvement and Disparities has established a community of practice in London, and this allows sharing of best practice. And at one of these meetings, for example, Sherwood Forest, who are an early implementer site nationally, they came along and they shared their learnings, and that was really helpful. It was helpful for everyone, and definitely for many of our trusts in North East London. And then we also have a North East London Tobacco Dependence treatment program, and that's a steering group, and that's where the trusts come together and the stakeholders to basically mobilise the program locally.
Fantastic. Thank you, Andrew. That's great. So what I'm hearing really is that you've obviously got that overarching way of connecting people, Andrew. I've just seen with our conversations how deftly you just connect people up, but also those formal networks. And then these networks are improving the reducing patient loss to follow up and improving quit rates. Also allowing you to tackle the complexity of the patients as well that you're dealing with. So I think that really shows the power of the networks.
Yes.
Maddie, I know that Andrew was telling me just how you've been in the thick of all this and just so brilliant at creating lots of networks. And I just was wondering if you could just tell us personally, just how does it feel now, these networks, what difference has it made? How does it feel to be part of those networks in that really well-networked region?
Thanks, Olivia. So I think it's worth saying that we came from no specialist service 2 years ago to a very successful service with very quick rates. and pathways with all services that we've mentioned, with NHS, with substance misuse, pharmacies. So we have pathways in place for all services. And worth mentioning, Newham is quite a deprived borough, unfortunately, and we still deal with a lot of inequalities, which we managed to actually tackle by using our networks, reaching those priority groups, creating links and getting those hard to reach smokers and engage with them. And this is obviously seen in the numbers, in the quit rates, in the registrations, in the feedback from the service users. So our smoking and tobacco work is so embedded in the community that our residents feel very actually as a friendly face, our service. So I think it's worth saying that our residents are part of our network as well.
Great. Yeah, it's really important having that patient involvement. It makes a difference to how you feel. I bet you feel a lot more supported and so on as professionals, as well as making sure that that feeds through into how the patients are feeling then as well, because we have to be well resourced, don't we, as professionals, if we're able to give to the patients as well and give them their care that they need. So yeah, fantastic. Thank you so much. So in the last kind of 4 minutes or so, what I'd love is to kind of hear from you. So not everywhere is so well networked in. It's been really nice to hear your journey, because you haven't come from the place where you've always had good networks. These are something that's grown. So I'd like to hear your top tips for people if they're looking to grow their networks. So Aidan, can I come to you first? Is that okay?
Yeah, absolutely. I think really important takeaway for us has been identifying where yourself and partners in your local area have shared priorities and goals. That's really integral to building a strong relationship. For example, just as Sanjay is on the call today, the Stop Smoking service that's run by Queen Mary Uni of London particularly prioritises support for tobacco users who have underlying health conditions and are seeking support during their pregnancy. So it really feeds well into what we're trying to deliver as a trust, and it's actually so the latter, so the pregnant women have informed how we've adapted our smoking in pregnancy service within our trust, given funding shortfalls for a completely in-house service. So it's worked really well in that sense.
Great, thanks, Aidan. We've got 3 minutes left, so so you've got a minute each of you guys. So Maddie, very quickly, what would be your top tip for people to take away very briefly?
I think my top tip would be to have regular sessions and don't be afraid to communicate, be transparent, state your issues, because you never know where your help can come from in a network like this. It can be absolutely any stakeholder there. They'll have a brilliant idea to fill your gap.
Great, thanks so much. Ask for help is the thing, which we're going to have an opportunity to do that a bit later. Great, thank you. Andrew, what was your top tip very briefly, or top tips?
So I think when we were talking last week, Olivia, about behaviours, so I might not have one, but it's about remaining passionate and driven to improve patient outcomes, demonstrating an attitude of being there to help others. Personally, I would rather someone ask me for help rather than had to try and struggle themselves. And if I don't know, then linking them into other people that might be able to help them, so that will help them progress their work. Being open and generous with sharing, learning and resources. It's a win-win situation. I might help with them today and share something, but tomorrow they may help me and share something. So often in the work we do, there's no need to reinvent the wheel. Act as a sounding board, have people listen to your peers, but also be there to bounce ideas off, and embrace opportunities, viewing them as an opportunity rather than a threat.
Perfect. Yeah, all of those sound really important things to think about when we're interacting with other network members. Brilliant, thank you. And finally, Shamsia, your top tips for people to take away about forming good networks.
Thanks, Olivia. Start small, don't be afraid. I mean, it may start with one person, and it's, if that one person knows a few other people, it will snowball into a sort of a bigger network, and work on common goals. Don't be afraid to talk about stuff. If there is a problem, I mean, follow the data. If there's some discrepancy, okay, so where's that data from? Who can I go and talk to about this? So make those connections, and don't be afraid, even if it's small, it will then eventually snowball. It's who and it has been helpful for me.
Great, thank you very much. Great thing. Start small, just connect with one person and grow it from there. It's a great final message. Thank you so much, all of you, for all your contributions. And I'll hand back to Stephen now. Thank you, and we'll all turn our cameras off. Thanks.
Thanks, Olivia. Well, top tips from a top team. Thanks, Aidan, Maddie, Shamsi, and Andrew. I think absolutely the power of networks and their fundamental importance to our challenge was really clear, and your enthusiasm really, I felt it across the network we're in today. So tremendous. Thanks very much. So we're going to change our focus now to what support's available nationally. We've got 6 national partners. Each have got a short, sharp presentation, I think around about three minutes, and then Olivia's got the task of summarising all of that as we run through. So I think we're starting with Ash. Thank you.
Yeah, we are, and please do all turn your cameras on. The just the partners, that would be great. So I know that many of you are friends of Ash, but in case you're new in this space, I just want to tell you a bit more about Action on Smoking and Health. So we're a public health charity. We've been around for just over 50 years and was started by the Royal College of Physicians with the vision to end the harms of tobacco, essentially. And we've got two main ways of doing this. One through expert campaigning, and secondly through implementation support, which is my work. Next slide, please. So there are 3 ways that we do this. Supporting connecting and collaboration through excellent resources and through senior leadership engagement. So I'll take each of these in turn. So first slide, next slide, please. So many of you will encounter our networks. Of course, we've got this network, the Smokefree NHS Network, which is primarily which is looking at cross-cutting issues to look at which cover the acute maternity and mental health, but also issues specific to the acute sector, given that we've already got a pregnancy and mental health network that cover those specific areas. And they work in a similar way to this one, with regular updates and meetups and some drop-ins. So next slide, please, and we'll move on to resources. So we have a specific resource hub to support implementation of the NHS long-term planned tobacco dependence treatment services in the acute sector, and also with nods to the mental health and maternity settings. So and there's a link to that should appear in the chat. And we've got a mixture there of webinar recordings, case studies, tools, and links to our partner program. So you'll hear about several resource hubs during this section. The distinctive element is links with our partners, and it's a curated selection of resources as well, which contrasts with NHS Futures, which is comprehensive, I would say. So we've also got specialty specific resources in maternity and mental health, if those are your specific areas as well. Moving on to the third area, senior leadership engagement. So some of our key areas on this are the Smoke-Free NHS Pledge. So some of you may have activated this in your organisation, whether it's an ICB, a trust, or a PCS. And this is essentially a set of commitments that which is great for engaging the senior leadership in this process, that then they commit to putting in place to create a smoke-free environment in the organisation. And the second area is briefings for ICSs. So these look at the impact of smoking on the population of the ICS, taking their local data and identify priority areas for action. So the main thing is taking data and moving that into action. Great. Well, thank you very much. I'll pass over to my my colleagues at the BTS. Zahir.
Hi, thank you very much. Hi, I'm Zahir. I'm a respiratory consultant working in London, and I'm also the chair of the British Thoracic Society Specialist Advisory Group on Tobacco Dependency. So the British Thoracic Society is now 40 years old, and it has a very long...
You've just muted yourself, Zahir, I think.
There you go. The British Thoracic Society is 40 years old, and one of our specialist advisory groups is the Tobacco Dependency Specialist Advisory Group. And our role is to help our many members with all things to do with tobacco. We have respiratory consultants and doctors, we have nurses, we have all kinds of different healthcare professionals as our members. And one of our major pieces of work each year is actually, well, every few years, in fact, is to do a national audit on the provision of stop smoking services in secondary care. That's been going on since 2017, and that's really helped to highlight some of the huge gaps that have existed historically and still exist to this day in terms of supporting inpatient smokers. Alongside that, we provide lots of different learning materials and resources via our Respiratory Futures website. Next slide, please. So within our website, we have Respiratory's website, we have a dedicated area on the tobacco dependency project where we're working with with NHS England, and part of that is helping trusts to be ready with to provide stop smoking services as a matter of course for any patient who spends one night in hospital, and trying to help them achieve the goals of the NHS long-term plan. And within that, we've got all kinds of different materials on the Respiratory Futures website. It includes case studies, it involves business cases on how to get project managers, for example, or tobacco dependency advisors. So it's a really good, rich resource. Really advise everyone to go over and have a look, and hopefully it will mean you don't have to do as much work as you think you need to do when setting up a stop smoking service, particularly in secondary care. We'll be providing regular drop-in sessions and webinars, and they're advertised through our Respiratory Futures website. And it's a great opportunity to network as well as to ask questions to experts. Later on in the year, on 7th of December, in fact, we've got a short course on tobacco dependency. This is really aimed at any healthcare professional who's going to be supporting a patient in a quit journey. We really want to see tobacco dependency advisors and all kinds of other healthcare professionals signing up to that, because it's going to be a fantastic day. We've got some brilliant speakers, and hopefully it will empower lots and lots of people to become more confident and more skilled in helping smokers quit. And we'll have a quality improvement program. And I don't know if I won't say anything more about that because we may be talking about that later on, but that's where we're supporting trusts directly with their journey in terms of...
Robin will just be coming in now to talk about that now. Thanks.
I thought so. I'll hand over to Robin now. Thank you very much.
Thank you. If we go to the next slide, please. Lovely. So I'm Robin de Cruz. I'm currently undertaking a Tobacco Dependency Quality Improvement Fellowship with BTS. And in light of the results of the consecutive audits on treating tobacco dependency in acute hospitals, as we've spoken about, actually these have shown poor results and little improvement over time. So that's why we felt there was a need for a new quality improvement programme. And this is aimed at acute hospitals who have their tobacco dependency pathways up and running. And it's really focused on improving the outcomes of these pathways. So we're currently in the delivery phase. So we've got the first cohort of 25 teams from across the UK, and the programme consists of webinars and group coaching. It's really focused on equipping teams with knowledge and skills so they can undertake their own quality improvement projects. And it's focusing on the element of their pathway that's most relevant to them. So to say that the resources from this programme will be available on the BTS website, and teams who have participated are going to be encouraged to share their progress and their successes, and any future programmes will be advertised through the BTS newsletter and their social media platforms. Thank you.
Fantastic. Thanks, Robin. We've got Emily next. Just a reminder just to keep to time, your 2 to 3 minutes. We're running a bit behind. Thanks.
Thanks, Olivia. Hi everyone, I'm Emily Cannon. I'm Head of Quality Improvement in the National Collaborating Centre for Mental Health. So we're a collaboration between the Royal College of Psychiatrists and University College London, and we support the implementation of high quality mental health care. And one of the functions of our team is running quality improvement collaboratives, which is why I'm here to speak with you today. So if we can move on to the next slide, please. Thank you. So we know that people with a severe mental illness have a reduced life expectancy, and one of the biggest things that we can do to address this is to support people to stop smoking. So we're running the Quality Improvement in Tobacco Treatment Collaborative, which is also referred to as the QUIT Collaborative. We launched in November with the aim of increasing the percentage of patients undertaking meaningful tobacco treatment on inpatient mental health wards. So we're delivering the collaborative in 2 rounds, and we're underway with round 1 at the moment and bringing more trusts on board later in the year. So we provide quality improvement support to the trusts that are taking part, and in addition to that, facilitating everyone to learn and share from each other at our quarterly learning sets and other virtual workshops. So I'm about to hand over now to Jenny Houlihan, who is a tobacco dependence lead at North East London NHS Foundation Trust, one of the trusts actually participating, to tell you a little bit about how the Quality Improvement Collaborative is working in practice. And I will also put a link in the chat to our website where you can read a little bit more about the Quality Improvement Collaborative. So if you move on to the next slide, please, Jim, and hopefully Jenny will be able to come in now.
Hello, thank you very much, Emily. Well, the QUIT programme so far for NELST has been amazing. The ideas, sharing information has been really useful. We saw a presentation from Reading Service, and they talked about how they had introduced training in their search training for their mental health services, which NELST ARD, the Goodmayes Hospital is based in, that's where I'm based. Right, I'll take a deep breath. Okay, so the search training has been really, really good because we've been able to get onto the search training, and we have 200 staff based at ARD, and I've managed to reach 157 of them. When we did the search training, asking them, the staff, what the challenges are. We're a smoke-free site, and how we can become smoke-free. Listening to them and their challenges was really, really helpful because they're the experts. So Reading had presented that they had 167 Datexes, and they'd managed to get them by introducing their smoke-free program from 160 in October down to 10 in December and 3 in January. So the staff at NELST have been very moved by this and actually quite excited about it. And I've managed to get, 49 champions signed up. Staff are really excited about it, and we're ready to move now to the next phase. So the QUIT programme has been really supportive for us, along with Andrew's team, the North East London ICB, that we've had a lot of support from them. So
fantastic, because again, the power of networks and quality improvement together is even more powerful. Great, thanks, Jenny. That's great to hear that. Lovely. Sophia. I'm so sorry, it's Martin.
That's okay. Thank you. So good afternoon, everybody. So I am Martin from OID, the Office for Health Improvement and Disparities, which is part of the Department of Health. I guess we were formerly known as part of Public Health England. So that's our background. Apologies for the lack of slides. This is first day after holiday, so big apologies to that. But I guess Stephen at the very start and Sanjay kind of set out why this area of work and the long-term plan commitments is hugely important for the NHS. But I guess within the department, we'd also see this as a crucial plank in terms of delivering our Smoke-Free England ambition for 2030, which was set out in the previous tobacco control plan for England that ran out at the end of 2022. We're currently working really closely with ministers and policy colleagues to look at what the government's commitment around the next tobacco control plan is going to look like, and hopefully we'll have more to announce on that in the coming days and weeks. But it's impossible to see us achieving anything like the 2030 ambition without really engaging with the NHS. And of the 5.5 to 6 million smokers that still exist in England, we know that we'll engage with them most effectively if we can engage with them whilst they're in hospital or engaging with healthcare professionals. So I guess the most visible thing that we've been doing as OHID to support this work has been back in late 2020. We employed 7 members of staff to be regional tobacco control leads in support of the tobacco long-term plan commitments, and all the feedback I've received on the work they've been doing, both strategically with ICBs, but also operationally with trusts, in helping to kind of work through some of those pathways that Sanjay was talking about before. That's all been really positive. Unfortunately, as I'm sure many of you will know, those posts are coming to an end at the end of March, and we're looking to see what future arrangements might be in place to help continue some of that support. Next slide, please. So, as already mentioned, whilst they've been in post, those 7 roles have been working really closely with local systems and regional systems, and they've developed a number of resources to support this work, be those checklists or looking at pathways. Some of those are quite localized, and some of those are applicable across the country, and many of them are already on NHS Futures, and we're looking to see what we can do over the next few days and weeks to rationalise some of those resources so that they're more accessible to everyone. And thinking ahead beyond March, the department's very keen to continue supporting around some of the clear tobacco self-improvement tools. So hopefully some of you are aware of these. If not, a quick search of clear tobacco will show you there's a number of tools online which are designed to help local systems essentially do an MOT on where they are against stated best practice around tobacco control. And there are specific clear tools on things like smoking in pregnancy, smoking in mental health, and smoking in acute settings. And we stand ready as OHID to continue to support localities if they're interested in going through some of those clear processes. We'll also continue to support with resources like the local tobacco control profiles, which are updated on a regular basis. And as I've already mentioned, we're working really closely with ministers at the moment around what might go in as ambitions within the next tobacco control plan. And the last thing I'd say, and there's already been a little bit of chat around this in the chat function, is around e-cigarettes. And I know there's a number of things to kind of unpick about this, but one of the main deliverables that we're looking to achieve by the end of this month, actually, and certainly into early April, is the go live date of a procurement portal for e-cigarettes. So this is an online portal that's sanctioned and approved by Department of Health, and will allow public bodies to essentially purchase e-cigarettes on behalf of their services or their clients. And there'll definitely be a lot more to announce about that in the coming days and weeks. And I think I'm introducing Sophie at NCSCT next.
Thanks. Hi, everyone. Great to speak with you. Just a little bit about NCSCT. We are funded by the Department of Health, have been since 2009, to help support evidence-based practice for stop smoking services nationally. We work in England, but there's also a role Wales, Ireland, and in Scotland, as well as with the UKAF, where we also provide support. And the mission really is to look at moving evidence-based practice into those who are providing stop smoking services. And that includes training, that includes evidence briefings, that includes the delivery of courses online and virtually or face-to-face. And often we're part of other networks that are contributing to the greater purpose of supporting work in mental health and pregnancy and in other areas. Next slide. Just a little bit about the small role we've played in helping move the long-term care plan work forward. I think an important piece of work was guidance that was released a couple of years back that is also available on NHS Futures. It's the NHS NCSCT competency framework for training for inpatient, outpatient, mental health and maternity care. So that's a comprehensive set of documents that can really help guide the training and also competency assessment for the workforce that is supporting in these settings. Next slide. And a little bit around the training that's offered. There is a suite of online training programs and certification courses that NCSCT offers. They are available publicly, logging in via the link on the NCSCT website. These courses are designed for stop smoking practitioners, and there is the basic certification course and 2 specialty courses, one in pregnancy and one in mental health. There are also courses designed for healthcare providers, so frontline staff, or those who are interested in learning more about vaping or stop smoking medications, comprehensive courses are there. And just moving on from there, next slide. We released earlier this year with funding from the, just back one slide, I'm sorry. With funding from the NHS, a new training program, a training suite that's also accessible via the NCSD website. Just along the top of the of our webpage, there's a special link to the community mental health training suite that was designed to be delivered either by national training providers like the NCSCT or by localities. And on the screen are just the partners that help develop the mental health training. You can see there, University of York, King's College, basically all of the experts in the country gathered to put together a really high quality resource. And the images on the right of the screen are just some examples of what the training suite looks like. What can be downloaded are slide decks to deliver a comprehensive 2-day course for community mental health providers in smoking cessation, or that can be delivered as a series of small modules that you can download in a compilation of 17 smaller training sessions. Notes, PowerPoints, exercises, interactive sessions, and videos are all part of that training suite. Next slide. And very recently, we completed with the support of ASH and the NHS and the team, the prevention team, an inpatient training survey, a needs analysis, and a scoping exercise, which really was about defining what other training resources would be useful in supporting the great work that's happening across the NHS to support the LTP. And that's for frontline staff, but also for this new workforce of tobacco training advisors, tobacco treatment advisors, excuse me. So that's another piece of work that was just recently completed. Next slide. And more broadly, one of the big pieces of work that we do to look at moving evidence-based practice into the field is really to look at resources like fact sheets, clinical briefings. We have our standard treatment program, a suite of them now, directed to pharmacy, for stop smoking advisors in community or in maternity settings. And these documents are all on the website, but really are there to make sure that those delivering treatment services, whether you be practitioners, managers, or commissioners, have privy to the latest evidence-based practice in a format that's digestible, that is really about what it means to the field. And that's it for me, I think.
Great. Thanks, Sophia. Thanks. And then last but not least, Paul, we're running a little bit over time, so I don't know whether you might be able to just keep this as short as possible. Sorry to
I'll do my best.
This.
Right. No, that's fine. So hello, I'm Paul Chalila-Court. I work for NHS England. I think what I would say is that the role of NHS England is to provide leadership to the NHS, but it is a lot more complicated than that, and I won't go into detail. But there is the operating framework linked from the slides that you'll get that will give you more information. I think our vision is very much we want to see sustainable NHS-funded tobacco dependence treatment services rolled out into the NHS. And we were involved in writing the long-term plan and setting that vision and making sure that people get high quality healthcare for all, making sure we support improving outcomes. But very particularly when we're thinking about tobacco, is thinking about how do we provide national direction, but leave up to local delivery so that local systems can understand what they need to do and make sure that they do it in the way that they need to do it. Could I have the next slide? So what do we do to help support that? I think there's probably 3 main elements to this. There's the architecture, the resource and expertise that come hand in hand. In terms of the architecture, we set the strategic direction. We've got the NHS long-term plan. We've got mention in the planning guidance, which is the annual sort of marching orders for the NHS in terms of what people want to do. We've also we've sourced funding. There's new funding coming down for frontline services, but also to support systems and regions in terms of putting in some infrastructure to make sure there's some people there to support delivery. And there's other bits and pieces that we do around data collection, make sure we can demonstrate the impact, but also things like levers for assurance. There's the system oversight framework. People need to be submitting that data to be able to tick that box. The big part around resources is the NHS Futures site that's linked from these slides. I know Olivia's mentioned it already, but that's where we want to see a big repository of information and sharing of ideas. It's where we've got our guidance documents, our delivery models. It's got frequent asked questions document. It's got a forum for question and answers. But what I really wanted to be is a repository for examples of good practice that the people are doing across this network and across the wider NHS. So people should be able to upload and save things onto there so that then people can start to share those ideas and hopefully hit a tipping point where it becomes really useful for people. And then some of the other bits and pieces that we've got, we do have employed national specialty advisors. Sanjay, who talked at the very beginning, is one of them. We also have Dr. Misha Moore, who's an obstetrician, but also public health leader who supports from a maternity perspective as well. We have a lead midwife, a lady called Heidi Croucher, who I know is on the call somewhere. You're holding up your finger at me, so do I need to finish?
Yeah. Yes, please. That would be great. Paul,
okay,
thanks.
And just a few other bits and pieces that are on there on the slide that people can read, but I'll finish there.
Thanks so much, Paul. That's brilliant.
Well, thank you. And I'm going to go straight to Hazel Cheeseman. But again, the fact that we ran over that tells you the range and diversity of support. I mean, there's so much of it, so that's fantastic. So Hazel, Deputy CEO, Policy Director at ASH, work nationally and internationally on health and social care policies and leading two of the big coalitions around pregnancy and mental health for ASH. So I'm going to go straight to you, Hazel. We probably need to shave a couple of minutes off your 8 minutes if we can.
I shall talk quickly, Stephen. Okay, so if we move to the next slide. Oh, is it you, Olivia?
It's fine. We can send that out with the post event email. You carry on with your policy bit. Yeah.
Okay, so I really just give a little bit of a broader kind of context to the conversation that we're having today. There is a vision for this country to be smoke free, and ASH obviously our reason for existence is to work towards the goal of making smoking history, and we truly believe that is a realistic goal. If we put the right policies in place and we all work together, and the contribution of the NHS is not trivial to this ambition. If you keep I don't know, lots of animation on this slide, just scroll down, stop there. That's great. So we need the NHS so that we can reach smokers at that crucial moment. Smokers who are in contact with the NHS have often been smoking a long time and already sick from smoking. It's an absolutely crucial intervention point. And I really see the work that we're doing with the long-term plan as really only being the start of this. We need to make sure that we are able to reach every smoker everywhere in the NHS. But also, I think it's important to say that the NHS role is crucial, but it's not sufficient to get us there. We need all partners at all levels delivering. And Stephen's introduction at the beginning of the webinar, talking about what's happening in Humber and North Yorkshire and the investment that's being made across the system, is an important part of that jigsaw. And certainly, if we're going to reach a vision of a smoke-free future, then we need further regulation and we need national action. And the Minister has said that we can expect a response to the Khan review recommendations in the coming weeks. And so perhaps government will move forward with those actions. And we need new partners in disadvantaged communities, in the places where we know smokers are most likely to be. But we'll also need money to make these things happen. We have at ASH been long calling for a levy on the tobacco industry so that we have the resources to make this happen. We will be continuing to make that case to government. We will make that case to future governments as well. Because, as we can see in the chat today, that funding is not what we would like it to be to deliver this really important work. And we need to find the money to make sure we can do the job. If you click this thing again, Jim. So we're the community that know why this matters. We're in you guys are out there, you're in the hospitals, you're in the communities, you're seeing the impact that smoking has on our communities, on our populations. We would like more money to be able to do this job. We would like to be able to go further, to go faster, but we have more money today than we had 5 years ago to do this work. And so we have to do what we can with the resource available, but we can and should use our collective voices so that we can go further and we can achieve all the things that we need to. Go and move on to the next slide then, Jim. So I think it's worth remembering why we're here. These are all pictures of people who have died from smoking related illnesses over the last 50 years. My grandparents are on this slide. And the tobacco industry has taken nearly 8 million lives from us in the last 50 years. And it's our job to be part of ending that in the future. So I will leave that there and hand back to Stephen or Olivia.
Yeah, well, I can take you to the next. We're having a game now, basically. So it's a skill swap. So grab your smartphone, and we're going to do another Menti exercise. I would encourage you to go at the rate of everyone else, for us to do each question together and not rush ahead. So the idea of this is sharing and learning together, essentially, is one of the things that you said that you wanted out of a network. The slide will be coming up in a sec. I think Jim's going to share that. So we're going to start. Here we go. Here's the Mentimeter, so you can use the QR code. Better just get rid of those notifications, Jim, otherwise they won't be able to use the QR. That's it. So yeah, you'll be able to use a QR code or the link in the chat that Amy's put there. And we'll go to the first question. So this is all about really sharing time. We've got, so if you were going to have a coffee with someone and you would ask them a question, what question do you need answered to move forward your tobacco dependency work? Who do you need a conversation with? So it's less about swapping resources. It's more about sharing experiences. So it might be, I want to get my senior leadership team on board with the NHS pledge. You could look at our website, but you could also have a conversation with someone who, yeah, great, and put your contact details on there as well, because otherwise no one will be able to help you, which is the next part of the next one. So yeah, how do you provide NRT to clients that you're seeing? So make sure you put you'll need to put your details in the same bit as the question, otherwise people won't know who to contact. So yeah, so what questions do you have? What questions do you have? And put them here, because what we want then is to people after the event to be able to contact one another to answer these questions. So yeah, so we've got a campaign, we've got a sort of an engagement one here. How can we ensure all healthcare professionals understand the importance of treating tobacco dependency? So you might want to have someone, if you put your contact details there, someone else might be able to then pick up that question and get in touch with you. We've got some more coming through. We won't be able to scroll down, where we 41. Oh, we won't be able to scroll down. Yeah, great. How to get staff on board with the smoke-free sites. So that's a really good question. See whether you can put your contact details along with the questions as well. How can we ensure that all our, lots of engagement questions here I'm having coming through. So how can we ensure that all our partners have ownership and buy-in, not just healthcare providers? Great. How to get buy-in from the executive team. So yeah, have a think about. So yeah, so Carl here has done a great one. So he's asked about NHSE. Okay, there's not. Yeah, so having a question there plus your contact details, so someone will be able to get in touch with Carl now. How to engage? Oh, this looks interesting. How to engage with BAME communities. So yeah, if you're able to give some advice on that, you can contact Happy there. A lot of information, a question here about the cost of nicotine replacement therapy. So this is the place where you put your questions. There's some really fantastic answers there. So let's move now, and this is to encourage you to instead of coming to us or NHS England or any of our partners for answers, you're able to swap and contact one another when you put your contact details up there, so that you can get on with answering these questions amongst yourselves. So you've asked your questions, you've asked for help. The next Menti, which we're going to move on to now, is thinking about what you can offer others. So next slide, please. So what experience can you share with your community members? So, you know, you might be responding to some of those questions. Have you encouraged your senior leadership to invest in NRT? Have you started a network of BAME, a network in your trust? So if you've got some offers that you would like to say, I will meet with you I'm happy to meet with someone for a coffee. Don't forget to put your contact details, everyone. Do not press send before you add your contact details. so that people could then get in touch with you and benefit. Here we go, Laura. So we can get, so anyone could contact Laura and learn from her knowledge about getting collaborating with the local council. Kate also has some great expertise on that level. So there's someone, Ross, you can contact Ross to setting up a vape-friendly service. And there's some fantastic offers coming through here. So Emma has got experience in offering smoking cessation with the Mental Health Trust, so she's happy to speak to people about that and have a coffee. There's some lovely offers coming through here. This is really encouraging. What we're going to do is then make this available to you after the event, and you can scroll through and make contact with each other. Similarly, if there are groups of people with the same question, you may want to set up a little group huddle or call. And if you need help doing that, if you need like a Zoom account or something like that, we're also happy to help. But equally, if you're able to do as much as possible by yourselves, that is also great. So this is the first time we've done this, so I just wanted to get a sense for you. Wonder whether you'd ask a few questions about how useful this has been. So, Jim, would you move to the next slide, please? So we'll just wonder whether you'd let us know how likely you are to use the skills share after this event. So log in and kind of find out about, scroll through and kind of find out whether there's some useful things, useful contacts you can make. Whether you're likely to meet with someone you've connected with here today, and also whether you'd recommend the Smokefree NHS Network to your colleagues. So if you can vote on those, that would be great. Thank you very much. Thanks for everyone putting in their answers. We may share some of these later, but not right now. That's great. So that's good. And you can continue voting on that, but we'll move to the next one right now. So Jim, next slide, please. This is all about community and relationship. So we will continue building community as we continue with our various events. But right now, just wanted to find out to what extent this event made you feel part of a community. You may already feel part of the ASH community, or it may not have helped at all. It may have helped to some extent or very much so. And we'd love to hear your sense of what a difference this event has made to you, and that sense of being part of a community and supported, which is what we were exploring in the case study back there. Great. I think we've got one more question for you before I hand back to Stephen. Next slide, please, Jim. And now I just wanted to ask you very quickly a basic question. What was the most useful thing about today's event? So we've split it down into all the different elements. There is an all of the above, but you've got 3 votes to sort of select up to 3 things that you found the most helpful about today. So that just to help us when we do further events. And then this is the last question we'll be asking you, and then we'll move on to or pass back to Stephen. Great, that's lovely. So if we stop sharing now, Jim, and I'll pass back to Stephen. Thank you so much.
Thank you, Olivia. What a fantastic event. I feel privileged to have been here and attempting to steer you through that. Just so much really in that last hour and a half. So, thanks everybody for coming. Over 350 of you here today, and a big thank you to all of our speakers as well, and thanks Olivia as well for really it was a bit of a joint double act, wasn't it, really, as we went through, so appreciate your help throughout. So yeah, a great event and so much going on. You know, it's so encouraging really to see this, and you know, the potential power of this network is it's absolutely fantastic. What I'd really like you all to do, if you haven't done it already, please join this network, join us, and please invite others who weren't able to be here or within your own networks to join us as well, because, you know, that's the power of a movement, isn't it? The more people that get involved in this network, the better it will be. And I think there's been a whole load of stuff as well, which I should have mentioned in the chat, people making connections and ideas and so on. So I'm sure that's all going to be summarized as an outcome from this event. And of course, there will be the recording in due course. So I was really encouraged by being with you today, and I wish you all well with the work that you're doing. There's a couple of things that strike me really. I mean, there is a significant opportunity, I think, if we can get this right, presented by moving to integrated care systems and all that goes with that. There's clearly a lot of integration already in this arena, but the opportunity to use the new ways of working, and as someone was commenting during the event, not just within the NHS, but with all of our partners, is there to be seized. So I'll certainly be advocating that, and hopefully you can in your ICSs up and down the country. The other thing, sort of what I know from being in leadership positions for a long time, is what really matters usually in getting things done is a clear purpose. Well, there's a really clear purpose here. A strong leadership, that's evident. All the speakers and comments in the chat box, and strong advocacy with that, which we've clearly heard about today, and then commitment and drive. Well, I think that's communicated itself across the airwaves today. So I think this network is in a good position to make sure together that we can make smoking history. So thank you all very much, and have a nice day and a good week ahead. Thank you.
Thank you for sharing, Stephen. It's wonderful to have you here. Thank you.